everyone, welcome back. Today we are talking about how to prepare for the AMC MCQ exam. Having gone through it myself, I'll be sharing some tips and strategies that help me pass the exam. Whether you're just getting started or deep into your preparation, I've got some valuable advice for you, so stick around. First, let's get into what the AMC MCQ exam is all about. It consists of 150 multiple choice questions across clinical topics like general practice, surgery, pediatrics, internal medicine, ethics, psychiatry. You have 3.5 hours to complete it, so time management is super important. Out of the 150 questions you answer, 30 will be called research questions, which means these 30 questions which will not be adding any marks for the final score. You will have to still answer them. If you're efficient with your time, you will be able to answer until the last 20 questions are over. And out of the all 150, these last 20 questions are marked and they contribute towards your final score. So if you're efficient with your time, you're going to pass. AMC handbook was a very good guide to understand how questions will be at the exam. So in my exam, I still did not receive at least one MCQ question directly from the handbook. But I heard some other doctors got the MCQ handbook questions. So do it because it helps you to improve your knowledge and your approach to the questions. While handbook is a useful guide, you need to focus on building your clinical reasoning and broader medical knowledge. Next is your study plan. So throughout the duration you're preparing for your exam, you have to have a study plan which you're going to follow, and you should be very familiar with this. This is incredibly helpful to have a good study plan. This allowed me to get familiar with the type of questions that are likely to come up and how to approach them. There are so many resources out there. Out of them, I would recommend, definitely like every other person, I would say John Murtaugh's General Practice was a very good book. This book is a must for understanding clinical cases in Australia. And then the AMC handbook, which I did, it improved my knowledge and the approach to questions. With the descriptions given, it improved my knowledge and clinical reasoning. And the third thing was the updates. There are many updates about the previous exams and the common questions being asked at the exam. Do every update, which is super helpful. I cannot directly tell you which bridging course is the best, but for me, I can let you know what gave me the best results. I followed AMC's 6 weeks MCQ preparation course. I cannot tell you directly which one is the best, but I definitely suggest following this AMC's or Alan Roberts Center's course because it was helpful in sharpening my critical thinking and time management skills during the exam. The teachers like Dr. Ashok and Dr. Anita were super talented. Their guidance were simply wonderful. I would say that I felt like they are world-class trainers for this specific exam. If I talk about the course, first we were given an introduction and we were trained how to analyze each option given in the answers. Like out of 5 options, in every question you're supposed to arrive at the best possible answer. So best answer. And when we reach the final 2 answers, it feels a bit difficult to select one, but how to select the best answer correctly within a short time is trained to us during this course. This totally changed the way I look at a question and how I use my time efficiently to think critically and confidently find the right answer. Once each subject was revised with the students, we discussed the questions coming from each topic and with clear explanations why we selected that specific answer. And my next tip to give you is teamwork. Like, I had a one-to-one study partner who also I met through this AMC's course, and she was very knowledgeable. I'm thankful to her even today. She corrected every mistake I made in doing the exam questions. So she helped me to spot mistakes, and we supported each other throughout this preparation process, correcting each other's mistakes and correcting the knowledge in the specific areas we made mistakes. It's important to have a good study partner who is willing to correct your mistakes. It's not about studying alone, it's about teamwork. I also had a group which we discussed questions, and yeah, having a group is also important. So I had two groups. One group is a lot of people, which we discussed the MCQ questions, and the other one was the one-to-one study partner, only she and me, which we were correcting each other while we did the questions. During the preparation, during the trial exams as well, I understood how my feelings will be in the actual exam. And doing these trial exams are very important because it helps to build the confidence and maintain it throughout the 3.5 hours you will be continuously answering the questions at your actual exam. Still, I would say it's very important to stay calm. When you find a difficult question, do not panic. I know the MCQ exam is challenging, but if you prepared well, you'll be fine and make through it. Make sure you're well rested before the exam. Have a good night's sleep the day before the exam. And what I did, I would give you as a tip. I went to find where my exam center is. I walked to the center and made sure decided before the exam date, I decided how I'm going to travel to the exam center, which was helpful again because I did not have to worry about undue delays during traveling to the exam center, and I always knew how I'm going to travel there. Being confident is important. That's what I'm trying to tell you. During the exam, don't panic if a question is tough. Use your clinical reasoning, make an educated guess, and move on. Trust your preparation. You got this. Preparing for the MCQ is all about having a good plan, practicing updates, and working as a team. If you put in the effort, you'll be ready to take on the exam with good confidence. I hope this video helped you. If it helped you, please give a thumbs up and subscribe.